Okay, we have a very, very packed agenda. I anticipate we'll probably have people coming in and coming out. Some things to point out before we get started. There's agendas. On the back of your agenda is additional information on what we're getting presented today, as well as a couple of the announcements we're going to talk about. There's an evaluation up here, as well as if you're interested in CEUs, you get a continuing education unit through MTC, an hour for today. So, and that's for free. Make sure you fill those forms out, get them back, to me at the end of the day to turn with your evaluation. There are a couple reports we're going to talk about today that are also up here, including the life report and the YRBS, the Youth Risk Behavior Survey report. Both of those have two documents that you could take. There's a middle school and high school report, which are sitting right in front of each other, as well as the life report has a snapshot document too. All of these reports are available online. So, and we'll talk a little bit more about that. But some of the things that are coming up as far as any, you don't have any minutes from last meeting because our meeting really revolved around the showing of the Marathon County Teen documentary series. If you haven't seen it, you can check it out at healthymarathoncounty.org. And that series is actually based on our 2015 Youth Risk Behavior Survey report. It's students' reactions to what was included in that report, as well as some of the new data that you have in front of you. We actually included it in the video prior to even the data being released. So you kind of got a sneak peek and you probably didn't even realize it. Some of the things coming up, we have our 9th annual Spotlight event. We're theming it this year, Champions of Change. We're going to try to keep that theme as we go throughout this year. It is going to be April 17th, and it's going to be in the evening from 5 to 7. That event, we actually take, I believe that's on your agendas, we actually take nominations. We do 5 Spotlight Awards every year for individuals, groups, organizations, efforts that are in the community that help reduce the burden of substance abuse, support recovery. And so we're going to take nominations for those awards, as well as we're going to be doing silent auction again this year. So if you have any items, I always say it's the best time to re-gift that gift that you just never took out of the box. I'm half kidding. It does work. So if you are looking to do a silent auction, we definitely reach out to me. Hi, come on in. Go ahead. Agendas. I'm going to point out now that you're in. Okay. Agendas, evaluations, CEUs if needed. The other announcements that I want to make sure that we cover, that one's not my flash drive, is our. We do still have a couple spots for our recovery coaching training that's actually coming up this weekend. So if you want to hang out with me and about 25 of our closest friends and get trained as a certified recovery coach, I encourage you to reach out to me. Let me know. I'll get you an application as soon as possible. And that's really all I have to say about that. Right now we have over 50 people trained that live or serve in Marathon County or Central Wisconsin. And we are actually creating a Central Wisconsin Recovery Coaching Network to kind of be the web or the net that kind of holds our recovery coaches together. So whether you're working within your organization, whether you're working on your own as an individual, you're working under JUUL, which is providing the trainings for us. We've contracted with them for those trainings. We're just all about bringing our recovery coaches together and continuing that conversation. Also this Friday, as part of that training, we actually always include naloxone and Narcan trainings. We're going to be doing a free training. Anybody's welcome to attend. We moved it into the theater just so that we can fit easier. It is a half-an-hour training. It's going to be done by the AIDS Resource Center. And anybody that participates will either get the Narcan nasal mist, you get 2 doses, or you get the injectable version, which is 3 doses. And that's just free of charge. So anybody who wants to be trained in that, please think about attending. And we're also going to be looking at doing additional trainings in the future. So if you work for an organization that may benefit from that, reach out to me or reach out to Carly and we can help get that kind of training set up. With that, I believe that was the last of my announcements. I'm going to turn it over to Jenna Otterholt, who will introduce herself. She is our newest tobacco person. And I'm going to start passing around the sign-in. On the sign-in, it's just, do you plan on attending the spotlight? Definitely, yes. Strong maybe. Or not interested. There's 2 sides to this. And for those that came in just a little bit later, for anybody that wants CEs, make sure you turn those in. Agendas, evaluations. Oh, and two other things I forgot to mention, I apologize, is we have 2 new recovery groups starting in Marathon County. So if you have anywhere to hang these posters up, grab 1, 2, 5. I grabbed 25. I can send it to you electronically. But Celebrate Recovery is getting restarted at Christian Assembly downtown, right by the police department, fire department. And then we're actually newly launched Nar-Anon meeting. The closest Nar-Anon meeting to us right now, before this, was Marshfield. So anybody that's interested in getting support for their families had to travel at least an hour to get that support. So this group is going to be starting at Mount Olive Church in Rothschild, or Mount Calvary, excuse me, in Rothschild. So again, we have 2 different flyers up here. Please take. And Jenna.
All right.
It's to you. And there was a couple slides if you want to click it all. It's up to you.
Okay. Hi, everybody. My name is Jenna Otterholt. I'm the tobacco coordinator for the Central Wisconsin Tobacco Free Coalition. I'm here to give you a brief update on new products. I just want to show of hands, how many have heard of JUUL? A couple people. Okay, so I'm giving you some new information. All right, I'm going to pass around this new electronic nicotine delivery system, also might be known as an e-cigarette to some of you. So you can see the packaging and the casing. The long piece is actually the device. There's a charger and there's a pod, so I'll pass around the packaging as well. So what I want you to know is that the product is on the rise, especially among youth, and it's happening in Wisconsin as well. With the pod and the inserts and the charger, it's $50 total. Something else that's interesting is that one single pod actually has the same amount of nicotine as a pack of cigarettes. And it's created to look edgy. It can be very sneaky in schools, so I encourage you to be on the lookout if you do work with youth, and inform those around you that work with youth. And please reach out to me and let me know if you want assistance, if anybody needs any kind of presentations or just information, that would be good. And also just something quick to note that Big Tobacco is still targeting youth, while actual traditional cigarettes are still on the decrease. E-cigarettes are on the rise and is the most commonly used tobacco product nationally. And we know that 13% of high school students use e-cigarettes. Actually, our YRBS information, which Melissa's going to touch on, shows that 6.4% of WASA students use e-cigarettes, but we only got data from 4 schools, so that's something to keep in mind. And we know that 88% of youth wouldn't use e-cigarettes if they weren't flavored. So the JUUL device that I'm passing on, I think the particular flavor is fruit medley, so it just goes to show that Big Tobacco is still targeting youth. So just a quick update on our coalition. We are working on initiatives specifically revolving around behavioral health and smoke-free outdoor spaces. If you would like to be involved or just get updates, thank you. I'm sending up updates on our website about monthly, so if you just want to be involved in what's going on in the tobacco world, specifically for Central Wisconsin, you can sign up for these updates. It doesn't require anything, just an email, and you'll get an email likely once a month. Another initiative that we're doing is we're aiming to reduce tobacco-related disparities, and also our effort is to create health equity. So my ask for you is to be aware of these new products, and please seek me out as a resource if you need. All right, I think that's my spiel.
There's a variety of handouts. Do you want to talk about what's up here?
Yep.
And your cards?
Yep, so I have cards here if anybody does want to have my contact information. I have specific information on tobacco-related disparities if you work with specific populations that may be beneficial to you, and more information on e-cigarettes and targeting of youth. Perfect.
So all those resources, thank you, Jenna. All those resources are up here. Is there any questions for Jenna?
Well, we could have passed around you see how it looks just like a flash drive? When Jenna first showed us this, she passed around literally with a flash drive, and there was some other piece of electronic equipment too. You can't tell the difference. And when these products first started coming out, what they were noticing is that there's a lot of people that didn't actually even know what they were. Like schools actually had students like charging them in the classrooms and selling hits in the bathroom. So it is something that's a rising trend. So as Jenna said, I'm going to go over some of the data coming up here in a little bit. However, I'm going to turn it right now over to the, I'm going to still say newly launched CART team, and they're going to give you a little bit more information on this new program that's available here in the community. And our clicker works. Click on.
Laser pointer, don't point it in place.
You got the power?
That's it?
You got all the power?
You're it. Good morning, everybody. My name is Megan Sawinski, and I'm a deputy with the Marathon County Sheriff's Office. Started with them back in 2012 and recently accepted this new position with the Marathon County CART team. Without looking up there, how many knew what CART stood for? Oh, yay.
Majority.
That means our name's getting up,
All
and
right,
that makes me
yeah.
happy.
It's on their agendas now.
Oh, you ruined it.
Cheating, all right.
This is my partner Dave, and I'll let him introduce himself as well.
Hello, I'm Dave Bertram. I've been with the Wausau Police Department for about 2.5 years. Been an officer for about 4.5, and we started the team at the same time. Both teams are partnered up with clinicians from the healthcare center. Chuck Kirstel and I are partners, and Stacy Roselle and Megan are partners. You guys want to give your little spiel?
Hello, I'm Chuck Kirstel. I'm a crisis professional with North Central Healthcare. I've been doing crisis services for 30 years, 25 mobile crisis in different states, actually, Arizona and here in Wisconsin. So that's my specialty.
I'm Stacy. I've been in the crisis center for about 10 years. I really like the idea of this, so I went for it. Happy to be part of it.
Thank you. I'm hitting the arrow down here. Thank you. We like to start out with some statistics for you guys. How many are aware of the amount of mental health illnesses that are dealt with every day? Some of you? Yeah. No, you guys don't see that at all, right? So just some stats here for you guys. 1 in 5 adults in America experience a mental illness. 1 in 25 have a serious mental illness. And then the typical age that we see is around 14, but 3/4 are the age of 24. Can anybody tell me why that happens? Why is 24 the lucky number? Bob? Sorry, you're the only one I know right away. Nancy, you're next, so. Why 24? What's going on in our lives when we're 24 years old?
College, brain development, all kinds of stuff like that going on.
Right, if you guys think about big things that happened in your life, you were early 20s, college, some of you marriage, some children, you have so much going on, you're making big decisions in your life. So when we see people who are having a psychotic break at 24, it's not, when you think about it in that aspect, it's not uncommon. Here are the top 4 mental illnesses that we see in America. Schizophrenia, bipolar, major depression, and anxiety disorders. And I would say what we've seen so far, these two agreed make sense that we don't see it as much as depression and anxiety disorders.
So the CART team, as you can see up here, we have the Memphis model listed here. The Memphis model is really just a process where law enforcement is tying themselves in with mental health in the area. And it's a way to insert law enforcement in an effort to reduce emergency detentions and involuntary commitments. So the Memphis model started with one police department working with their mental health team. They kind of established the program themselves, and slowly this program has been spreading throughout the United States. We're actually the first county organization in the United States where this is usually just a model used with a police department. Madison PD has a form of a CART team. Milwaukee has a form of a CART team. But Marathon County is the first county in the United States to establish a unified CART team. Right now, our CART team is made up of the Sheriff's Department and the Wausau Police Department. So it's kind of overseen by the Sheriff's Department, but we kind of operate out of the Police Department, and it's more of just room. We just have a little bit more room at the PD right now to operate like that. But we respond to all calls in the county. We focus on Sheriff Department and Wausau Police Department calls. However, other municipalities can request us if necessary. We focus on de-escalation. So just like any mental health care worker, crisis worker, we're usually not dealing with people on their best days. So our initial goal is to de-escalate a situation, bring a person back down to their normal, or at least reduce their stress level enough that we can provide a service. Can we build on that at all?
Yeah. We'll touch on de-escalation a little bit more in the next couple slides of what it actually looks like, what steps you can take. So if you encounter somebody who is in a crisis, just some ideas of things for you to kind of have in the back of your head until we can respond, or another officer or an actual crisis worker can respond to help you out. We also focus on problem solving. It can be as simple as somebody's in crisis because they don't have a pair of socks, or they don't have any clean laundry, they don't have any clean food. So we work with them. If it's because they don't have a ride, maybe one time we'll take them to Walmart, get them their food and take them home. We're not going to do that every time. They're not going to be able to be reliant on us to always take them to the store. But if it's something that we can provide them in that moment to avoid the crisis, then we know, okay, we need to do a follow-up visit with that person in 7 days or in 10 days, because they're going to be out of something, and we're going to have to get a plan set up so that whether it's a taxi or a family member who can help them out, get them that food, get them their clothes, so that they don't end up in that crisis when we have to deal with them again and then have to work through de-escalation to get them back down.
And with the problem solving, that's part of what's making this program is, in our eyes so far, a month that has been incredibly successful. We've seen the fruits of our labor already. And the biggest thing, we were just talking about this morning, we met with the community clubhouse here in Wausau. We were talking about, I think what makes this program so effective for us is, as officers, we have the freedom and the time to spend on these calls. You know, unfortunately, patrol officers and deputies, when they might be going to a mental health crisis call, they try to provide the assets and the assistance that they can, but quite frankly, sometimes they're pressed on time. They have other calls they have to take care of, other crimes that need to be dealt with. So we help alleviate some of that time constraints by being able to go there and spend sometimes hours with somebody. We have the freedom to do that and to do the least restrictive assistance, you know, with people. And that's part of our problem solving with that is just because they're having a bad day doesn't mean we need to put them in handcuffs or put them in the back of a squad car and take them down to the mental health facility, where we can maybe come up with a plan to keep them in the home, to get family involved, to offer program services and community resources.
And although we are still law enforcement, with the CART team, we take a soft approach. So every day that me and Dave come to work, this is what we wear. We are plain clothes, we are still armed, we still have the same capabilities, we're still able to enforce the same laws, but in speaking with clients that have mental illnesses that typically have had bad interaction with law enforcement, they've told us that when they see an officer in full uniform, that it's intimidating. It sometimes can be a trigger for them. And so by us showing up this way, I've had several clients that I've dealt with already that said, I didn't even know that you were a law enforcement officer. They're like, you don't look like the typical cop, and you certainly don't act like the typical cop. Which I guess, good and bad. I don't want to look like the typical cop, obviously. I still have all the same powers, I still do the same things, but I am able to present myself in a manner that is a little more warming to the people that I deal with. We kind of covered the rest. Again, we want to keep people in the home, and if they have a good support system where, you know, maybe they are suicidal, but they have their parents there, or they have their husband or their wife there, and they're able to stay with them through the night and call us if there's anything else that's maybe a little troubling that we would have to go back. But if we can keep them in the home and they have a good support system and set them up with outpatient services, that's our primary goal. And along with keeping them in their homes, that also, when Dave had talked about, you know, reducing the number of emergency detentions that we do, that also comes into play with reducing the number of people that are going to jail. We spoke with a client about a week and a half ago who told us that there would be times where he not only had a mental illness, but he was also homeless, and he would commit silly crimes like theft right in front of the clerk so that he could go to jail that night and have a bed to sleep in and have heat and have food. He wasn't doing it because he really wanted to. He was doing it because he didn't have a place to stay and he knew he could get medications and get help in the jail. And that's what we want to avoid, is people who are committing crimes for reasons such as being homeless or because they need something to eat and they want to stay warm.
And that's also, this position has already evolved. And we had an idea, Annie and I had an idea of what we wanted. We've been blessed with being able to be on the ground floor building this program. We had an idea of what the CART program was going to be, and I can say that this program has blossomed into way more than we ever thought it could be. Because we don't just come see you when you're in crisis. We take preventative steps as well. We have the flexibility with the healthcare center at our side to sometimes be referred. We'll have officers say, hey, I dealt with this situation. I believe there's more to this situation. An example, we had a domestic incident between a mother and son a couple weeks back. And the domestic coordinator came up to us and said, I think there's more underlying issues. I know that the son has some undiagnosed mental health issues. Would you guys be willing to meet with him and just have a discussion? And that's exactly what we did. We set up an appointment. We came to his house. We chit-chatted. We were able to suggest some services, kind of get a history, get his background on what services he's had in the past and all that. And we haven't had a call back, and as far as I understand, mom and son are doing quite well. He's been getting his treatments and working on himself, and mom's participating in the treatment. So we don't just have to come see you when you're in crisis. We do take the preventative actions. We get referrals from our school resource officers on occasion. We'll meet with students. I'm actually going to meet with a student on Friday. And it's more of a preventative, hey, do you have these resources? This is a face with the name. You know, this is who I am. This is who Chuck is. This is, you know, it's relationship building on top of dealing with crisis.
We're going to take a step back and go to de-escalation that we had talked about earlier. So when we get on scene, how many of you have had a fight with your significant other? Everybody put your hand up because it happens, right? Everybody, right? At some point or another. And maybe it gets heated and you guys are yelling back and forth. So if I start to yell, what does the other person typically do?
Yell louder.
Yell louder. So then I want to yell louder. And so what does that accomplish? Absolutely nothing. Now you're just screaming. Potentially your neighbors are hearing you, so now you're embarrassed because the whole neighborhood listened to you and your husband because you're fighting about something ridiculous. So yelling doesn't ever accomplish anything, right? So when we get on scene and we have somebody who's in crisis and they're escalated as high as they can go, when we get there, we have a very calm voice. We present ourselves in a manner that is inviting, because if I were to come up to you like this, what is your problem? Yeah, that doesn't really sound like I want to talk to you. So we come in with a nice calm voice, ask them what we can do for them. A lot of times we'll have them sit down. I'll sit on the same level with them. I want to be eye to eye. I want them to know that I'm not any better than them. I'm on their level and I'm here to help them get through what it is they're going through. And a lot of times that has to start with empathy and build to rapport.
Right, and we got active listening. Does anybody know what active listening is? Heard the term, use the term? See a lot of nodding heads, okay. And that's a big thing that I think is helping with interacting with cops. The active listening portion. Repeating back statements that your clients are making, acknowledging the statements they're making, acknowledging the questions they have. Active listening also helps where we've had a couple of instances where they do realize I'm an officer right out of the gate and want nothing to do with me. So we offer them, Stacy or Chuck, we want to talk to these people and we give them that space, which gets us into rapport and helps us with the influence of, with the end result being behavioral change. So we build this ladder or this stairwell here, and it's always with the objective of the client's best welfare in mind. What's the best options we can provide for this person today, and hopefully for the future to come, and with the end result being a behavioral change. Even if it's for the day, just get them where they need to be for the day, or at least get them to the resources that they need for the day. Because with any mental health issue, it's never a one-time deal or an instant fix. You know, we have our repeat clients, and so through our de-escalation, we keep that de-escalation going on as long as we can and keep it into a friendly relationship.
So as far as where and when CART will respond, a question that we get quite often is, how are you notified of a crisis? So our main way is through dispatch. If somebody calls 911, a family member or friend who's concerned about somebody, dispatch will call us and say, hey, can you go to this address for a welfare check, or if it's a suicidal person or somebody's not taking their medication, can you respond there? Another way that we get sent to calls is through the crisis center. They'll call us and say, I had this person on the phone for a half hour on the suicide hotline. I don't think they're doing very well. I'm not sure that they can contract for safety. Can you go do a welfare check and see how they're doing? We'll go out, we'll take Chuck and Stacy, have a conversation with them, and see where things need to go. Are they going to be okay? Can they be safe for the night? Or are they to the point where they may do some sort of self-harm, and then we have to take action, whether it's voluntarily, involuntarily. Currently, we respond primarily for the city of Wausau and the city limits, and then the county jurisdictions. However, with that being said, we will respond to Everest Metro, Rothschild, Kronewetter, Mosinee on a case-by-case basis. If we don't have anything going on and we're available, we'll go down, we'll take Chuck and Stacy, we'll do an assessment for them, but they're still going to take primary control of that scene, of that call. Whereas if it's a county call or a city call, we'll take the call over completely and go from there. So that's kind of the difference at this point. Eventually, we would like to be available to all jurisdictions in Marathon County. We just didn't want to overload ourselves in the beginning, because if we were to open it up to everybody in the county, 2 teams would not be able to handle that. We would have to be turning people down, and that's not what we want people to think of when they think of our program. We want to be available to everybody as much as we can, and in the future, grow to be available for everyone.
And we're not replacing the crisis center. That's been a misconception, I think, in some places. We're actually this is kind of a 2-pronged attack here. We're assisting crisis and we're assisting the police departments and the sheriff's department. We're trying to alleviate some of the pressures of an overwhelmed mental health care system. And, there's plenty of times it's already happened on one of those days we're getting a lot of calls, and there's times where both teams are out and both crisis workers are out at the same time. We're all still here, we're all still working together. We try to make CART as the go-to if we're available. And have you guys noticed a difference since we've started? I mean, just on the pressures of your response?
Yeah, it reduces the pressure.
Excellent.
And that leaves you guys available so that when you have walk-ins that you're there instead of being unavailable, we can go out and take those calls so that the crisis workers can stay in the center.
Is your reasoning for not responding to the schools and the jail because it's already, like at the school, the liaison officers are already there?
Right, so what it's talking about down here with not responding to the schools and the jails, with most schools now having the counselors in almost all schools at least part of the day or throughout the week, we allow them to work with the students as well as the school resource officers. So if there is a child who potentially is having a crisis, that'll be dealt with by the school resource officers. Mobile crisis is still taking the assessments as far as in the jails and up at the hospital. If we're available, we'll assist in those calls, but that's still kind of their thing. We are more community-based, and that's where our focus is keeping people in the home or people that are out in the community versus somebody who's already in a facility. That makes sense?
And the schools themselves, I mean, quite frankly, with adolescents, I mean, there's so much going on in those kids' lives and stuff. We don't have, the two teams can't handle the schools themselves. I mean, it'd be too many calls. So both county and city has a lot of CIT officers, we have crisis intervention teams. Almost every police officer in Wausau, and pretty darn close to all the deputies, are all CIT trained. So they're kind of our backup as well. If we are not available, crisis isn't immediately available, we have officers and deputies that are trained in dealing with crisis situations. So we kind of have a backup for the backup for the backup. And with the school's high amount of crisis calls they could have, we could spend the whole day in one school and still not be able to take care of every need in the school for those students. And there's other programs in place that are helping alleviate that. And we're also hoping that the CART team is going to be successful enough over the next year or so that we can show a need to get another team. We'd love to have 3 or 4 teams available, maybe a team for the school district and a team for the other jurisdictions. But that's part of why we don't respond to the schools or the jails is just it would spread us way too thin. And we're also trying to keep we want to be a positive team. We want people to want to reach out to our teams. And if we're only showing up for the bad days, that's kind of going to defeat the purpose of what we're trying to do with this team.
Currently, our hours are Monday through Friday, 10 a.m. to 6 p.m. That could potentially change, so we will keep everybody updated on what hours we are working, when we are available. But like they said, when we aren't working, there are crisis intervention teams. There are officers that are trained on crisis intervention, so they are our backup. So even if we're not working, it's not like any of the officers won't know how to handle a crisis. They've been through the training. They know at least how to get started and kind of work through a situation until a crisis worker can get there, or if it's during the day, we can get there and help de-escalate the situation. As far as numbers for 2017, Wausau PD had 189 detentions, and when I talk detentions, that is involuntary detentions. And the Sheriff's Office had 81. Our goal is to cut that in half, and I think we're on the right track. We've been tracking numbers from last year and this year as far as what calls CART was involved in, how many detentions we had that are involuntary, and what from this time last year in January?
In January 2017, I just looked at this morning, in January 2017, just for the Wausau Police Department, we had 21 involuntary detentions. We had 68 calls just as a department. This year on stat tracking for both the Sheriff's Department and the PD combined, we had 128 calls for service this month with only 20 detentions. So 2 departments combined with almost double the numbers, and we had around the same amount of detentions. So I see that as progress. We get to make about 35% of the calls as 2 teams. So we're already seeing numbers come down, and we've seen them come down over the years with the CIT training. Since 2015, the numbers come down almost consistently every year. They've gone down 15 to 20% with more and more officers getting the CIT training. So now the numbers are going down even more with emergency detentions with the CART team implemented. So we're, as a whole, the county is seeing a progress, great progress towards least restrictive means and keeping people in the home and not taking people to jail when really they need mental health assistance.
And I've spoke with some of the department heads down at North Central who stated their numbers on their inpatient unit are at like an all-time low. Is that correct?
That's correct.
So, and I would like to think that that also has to do with the CART team, with the CIT training, that not only, I don't think that there's more mental health, it's just we're more aware of it now. We're better equipped to deal with it because we're aware of it. I don't think that it's gotten any worse. I don't know that it's gotten any better, but now that we're aware of it, I'm hoping that we'll be able to help in making it better for everyone in Marathon County. Up here is our contact information. I can leave some of my cards on the front desk too for you guys to take, but we are, feel free to contact us at any of these emails. What isn't on here, we have a CART email. that we all have access to, and it's simply in caps CART, and then it's the same as
If you look
at
at,
Dave's
if you
right
look at my
here.
email at ciwausau.wi.us, just instead of Dave Bertram, just put Carter. And look, it's our email. So it's the department email. All of us have access to it. If you wanted to email the team, you can email that. If you want to email us directly, feel free. We're still reaching out and connecting with programs that apply to our situation, and we're trying to utilize that as resources to hand out to people and guide them to different places and different avenues. Because the more resources we can hand out, again, the least restrictive we can make it. And I mean, we're all on the same team here. We're all trying to accomplish the same mission, and that's to help the community. With all that being said, does anybody have any questions for any of us? Yes.
What's the difference between a request from dispatch and a request from law enforcement?
So if an officer is already on a scene, what we've run into a lot is a welfare check, where we'd like you to send an officer over to check on somebody for whatever reason that is. And what happens often is an officer gets there and finds that there's a mental health issue that's underlying here or whatever, and they can request our team to come out and bring our clinicians with us to do an assessment.
And
So-
that's dispatch?
What's that?
And that one?
That would be officer, that'd be law enforcement request.
Dispatch would be somebody, maybe a family member calls in 911 and says, my husband or my wife is talking kind of odd, making some, not exact suicidal statements, but he's not talking normal, kind of hinting that he's maybe suicidal. Can you come and have a chat with them? Or, unfortunately, sometimes there's people that have weapons that are threatening, say, suicide with a knife or with a gun or something like that, where they call 911 because it's an immediate crisis and there's a potential for harm not only to themselves but to other family members. That kind of information will come through dispatch.
Yeah, and that's the thing, like an officer might be sent to a person that is wandered down the street and they think is intoxicated. Officer gets on scene, realizes they're not intoxicated, there's a mental health issue. Again, that would be another example where law enforcement would request our team to come out just because we have the extra assets to take care of that
Right, and then
situation.
one more question. Have other CART teams nationally seen those halved numbers that your goal is? Where did that come from?
Yeah.
Yeah.
So when I took my CIT training, it's a week-long class, and I took it down at Madison. Madison and Milwaukee, Wisconsin are the poster child for CART programs and for CIT. And I can't remember the exact numbers, but just the city of Madison, once they started this program, they had dropped by 100 in a year for the number of detentions that they had done. So for us cutting in half, we think it's a pretty obtainable goal because other places have seen such drastic drops with their programs.
Is that 100, is it like 2,000 to like 1,900, or is it like?
I want to say they had gone from about 400 at one point to like 300, something like that. They have a bigger population than we do. So for us, cutting it in half would be obtainable, and that's kind of where our goals have come from other places, not only in Wisconsin, but in the United States that have seen drastic cuts in the amount of detentions.
And from the things we've seen, reading on other CART teams, how bigger cities deal with it, these numbers continue to go down and down and down, and a lot of that appears to be because the name's getting out there, more resources are being connected together, these teams are getting more opportunities to direct people to areas they need. Substance abuse programs, mental health treatment, even just assisting the family and communicating together. And that's where some of the preventative stuff that we're trying to do is coming out. We're seeing that the preventative measures in places like Milwaukee and Madison and things like that, that is assisting those numbers in coming out. Because if we only responded to the emergency calls and that was it, I don't feel we would see a significant enough change because it's not attacking the problem at its source.
And I would hope that there's been some times where people have called into 911 and they've requested a CIT trained officer. They know this patch, they know it's a CIT patch, they know that I have special training in dealing with somebody that's in crisis, and they will specifically ask for somebody who is a CIT trained officer. Now we've had a couple that have asked for the CART team because they've been told through a family member, hey, these people come out, this is what they do. They're not the typical law enforcement, they get it, they bring the crisis workers right to you, you don't have to go anywhere. So they're specifically requesting CIT and CART officers. So I hope that CART gets to be the same name as CIT. Do you have a question?
So will a person calling in be able to, I mean, the dispatcher's aware that, let's say, I'm from Ramlin, so if I go, I think it's best if the CART team comes. They're okay with that?
Yep, you can call and say, you know, where you're from, that you would like to request the CART team. They may ask what kind of situation you're dealing with, just to give us a little heads up so that we have an idea what we're walking into. We don't need specifics on it, but you know, if you have somebody who's in a crisis and you know that they're bipolar. So we kind of have an idea of how to respond once we get there. But yeah, you can call in, I would suggest calling the non-emergent number, unless it really is something with weapons or somebody's getting physical. Use the non-emergent number and you can request us.
Thanks.
You can request it specifically. The dispatch center has also been given our standard operating procedures and that. And they're trained to process a call that if it sounds like it could be a mental health call, they'll dispatch us anyways. So almost always if we're dispatched, if we're getting sent from dispatch, we'll usually respond with a uniform officer, and that's just because of the unknowns of the call. But if we get a personal request, it just depends on what the call entails. If it's I'm having some issues and it's a very, very low risk sounding call and things like that, typically we'll just respond alone. But if it is an aggressive call, there's weapons involved and stuff, we're still going to respond with uniform officers. You know, I have some of my tools, but I'm a little bit less geared up than a regular officer is, so we still need to bring for our safety and the client's safety as well. So we still will show up with uniform officers on half the calls, depending on the situation.
So, for the sake of time though, can you ask it quick, because we have four things we gotta
Yes, you just answered my
get to
question
yet.
about safety.
Oh.
So if it seems, you know, like a risky situation, you come with an officer. And then I think I know what active crisis means, but is that just more of a state of the person versus what the specific issue is? Like you mentioned, it could be over laundry, or, so is it just a very like, either revved up state, or like, is there a definition?
Active crisis, I would answer that as active crisis would be for that person. Active crisis, somebody could be really depressed, but they're seriously talking about harming themselves. And active crisis could also be the person that's screaming, running down the hallways with a bat. You know, it's still what is the danger to themselves and or to others is what active crisis would be.
And if I may, the crisis definition is the inability to cope with any situation.
Yep.
So anybody can be in crisis. I mean, it could be over spilled milk. I mean, the thing is that they have exceeded their coping mechanisms to deal with the situation.
Okay, so
It
sorry.
took up a lot more time than you planned.
That's okay. I know you guys had to scoot out too, right? Were you able to stay? Okay, well, that's good that we got question and answers now. We're good. No worries. Now
for
I'll
having
reject
us.
your question.
I hope we answered some questions. If you have any more questions, like I said, we got our emails and all that. I'll leave cards. Please reach out to us.
I do. I will leave some up.
Okay, so next we are going to have, I'm trying to eject the wrong one, that's why. We're gonna have Amanda come up from United Way and talk a little bit about, one of the things that we heard, or that I heard from people, was that they were hoping for a little bit more information on, it's gonna close everything here, on the life report itself. Hey, don't leave without your flashlight. So, I can't seem to eject your, it's not, it doesn't show up.
I'll just yank it if you're okay with it.
I'm okay with that.
No biggie, thank you.
So, sorry, I can't do two things at once. So Amanda's just gonna go over a little bit about what all went on with the life report, a little bit of history behind it and everything, and then we're gonna move On to the rest of our program, hope you can stay till the end, it's gonna be packed, you'll be next.
I promise I will talk really fast. So I'm Amanda Tabin from United Way of Marathon County, and I'm one of the members of the executive committee of the Life Report. Tara Drager from Aspirus is another member of that committee. So Tara, if I miss anything, chime right in. This Life Report is the 11th edition. It comes out every 2 years, which means that this has been going on for over 20 years. The purpose of the report is to acknowledge community strengths, identify challenges, and the big one, I think, is to serve as a catalyst for change by advancing community conversation and partnership. So I think that last one is why a lot of people, when it comes to the Life Report, are wondering what are the calls to action. There are many sponsors to the Life Report. I'm not going to read through them all, but they are on page 2 of the report, and the Life Report could not exist without support from the community, including all of these sponsors, as well as the many, many volunteers that take part in the creation of the Life Report. So this slide lists the steering committee. There are also subcommittees of community experts related to the various topics in the report who are doing the research, the commentary, and the community perspective portion, and they're also part of setting the priorities. Something new this year is an additional team of volunteers was part of the report. And basically, these are individuals who were not part of any committee with the Life Report up until the very end. They reviewed the section summaries that the subcommittees put together and helped between the successes and progress and calls to action from each subcommittee, reviewing them and thinking as a community, what are our overall successes and progress and what are our top overall calls to action. So they're the ones who really helped us to shape and whittle down what those top calls to action were, in addition to the steering committee. United Way serves as the hosting agency. Jesse Ladd was our project manager for the Life Report this year and did a fantastic job. I encourage you, if you look at the online version, it's full color and really sweet, so definitely check out the online version. New in this report is that there are 4 sections. In the past, there have been additional sections. That change is basically to help it mirror more closely with the Marathon County Comprehensive Plan, where the county hopes to be the most prosperous, healthiest, and safest county in the state. In addition to that, with the Life Report, we hope to have our community members be connected to each other, the community, and the resources that they need. As far as success and progress goes, we have great school systems. We're open to exploring diversity. There were initiatives like Toward One Wausau, the Unity Project that started over the past year and a half. We have great healthcare systems to provide access to general health care. And one thing I wanted to point out specifically to this group is that substance abuse education is on there, and that's in large part due to the work of a lot of you in this room. So kudos to all of you. Also on the list is data on youth risk behaviors, which you'll be hearing about in a little bit. As far as community assets, I'm guessing a lot of you are well aware that we live in a beautiful area with clean environment, again, access to great healthcare systems and education, good lifestyle here. But there are some areas where improvement is needed, and that's where the calls to action come in. So the first one is mental health, particularly as it pertains to youth, but also throughout the entire lifespan. Mental health challenges are becoming increasingly prevalent and well-known among others in the community, and it's something where as a community we realize that we don't have the number of providers that are needed, and that impacts people getting access to the support that they need. So that's why that is a call to action. Substance abuse is a call to action, and actually most of the rest of what I share will be focused on substance abuse. Bullying is a call to action in this life report. For those of you who have been around the community for a while and have heard previous calls to action, you'll note that bullying is different than a lot of calls to action in previous reports. And the reason this one rose as a top concern in the community this time around is because, particularly as far as youth goes, that's a concern that is noted in the Youth Risk Behavior Survey, but also for adults within the community. With the increased use of social media, it makes it a lot easier for individuals of all ages to partake in bullying behaviors. And so we wanted to call attention to that and work to address that issue. Broadband access is another one that hasn't been a top call to action before. For those of you who live in city limits, you may be a little confused as to why this is on there. But if you live outside of city limits, anywhere within Marathon County, you are probably well aware that broadband access is an issue. The cost goes up exponentially as you get out of city limits. And for a lot of people, particularly on the western side of the county, they may not have any options for broadband, or if they do, they are ridiculously expensive. I actually was at an event about a month ago where I heard someone talking about how their child, high school student, has to go outside to do homework if it's an emergency, because they have to get in a certain spot on their farm to get cell access to be able to look up stuff to do homework. So it is a very important issue and impacts people's education, healthcare access, and also impacts employers. The last call to action is future job growth. That is a call to action because, as I'm sure you all know, the senior population is growing rapidly, and as that population retires and as new jobs are created, there's going to be a lot of job openings. And so as a community, we need to figure out how to retract, retain, and train employees to make sure that they're able to fill those job openings as they come up. One thing this life report in particular called out is that our community is a system, and all of the indicators in the report, the sections of the report, and the calls to action are all really interconnected to each other. A lot of them have cause and effect relationships with each other, and so that's actually what I'm going to focus on for the next couple of minutes. And with this group talking about how substance abuse impacts the community system. So as far as the prosperous section of the report related to the economy and education, the workforce is impacted by substance abuse. As I just said, North Central Wisconsin is expected to have over 6,000 openings in the next 10 years. So think about that. How many of you have applied for a job before and had to do a drug test before employment? Quite a few. So substance abuse can impact a person's ability to get a job, as well as impact their ability to maintain a job. Education, ACEs, adverse childhood experiences, such as toxic stress caused through issues such as having domestic violence in the home, having mental illness in the home, having substance abuse occurring in the home. I won't rattle all of them off, but ACEs do impact not only a child's brain development and impact them throughout the course of their life, but it also impacts them right here and now. And when they go to school, it impacts their ability to learn. So if you think about if you're an 8 or 9-year-old child with a parent who has substance abuse issues, are you going to be able to concentrate on your math class if you're worried about going home and finding mom or dad passed out on the floor? Probably not. Substance abuse most obviously impacts the health system or healthy aspect of the life report. It can impact one's ability to meet basic needs such as housing, hunger, etc. And that may be because an addict may choose to use the resources they have to obtain their drug of choice versus paying for housing, food, etc. It also, for women of childbearing age, can impact whether the baby you're carrying could be born healthy or not, low birth weight, premature, all of those things are impacted. It also impacts premature death in the community through overdoses as well as through unintentional injuries. So this was a statistic in the life report that I found a little startling, and that is that unintentional injuries fell behind only cancer and heart disease in the age-adjusted death rate per 100,000 in Marathon County in 2015. So people are not only injuring themselves while under the influence, but they are dying due to being under the influence. Or things that they do while they're under the influence are killing them. And that's causing a lot of years lost of life, which is significant. The other area of the life report where substance abuse is seen heavily is in the safety section, which is no surprise. The CART team was just here and involves police officers. But alcohol and drug arrests have significantly increased, 94% with heroin cases and 89% for opioids. Traffic crashes. The top two causes of traffic crashes both involved alcohol. One just plain involved alcohol, and the other was a combination of alcohol and speed. Crime is impacted by substance abuse, whether someone decides to perhaps steal something in order to obtain money or resources to support their substance abuse habit, or commits a crime while under the influence. All of those things show that crime is very negatively impacted by substance abuse. And speaking of crime, violence and abuse are also connected to substance abuse. It's not one of those chicken and the egg situations where substance abuse causes violence or domestic abuse, but when those situations are occurring in a home, substance abuse does not help that situation. It only makes it worse and escalates the situation. And finally, the connected section of the report, which is brand new for this report. Before I talk about how substance abuse impacts the connected section, I want to share, you may be wondering what's in the connected section. So it talks about things like racial disparities in the justice system, discrimination, culture and the arts, broadband access, transportation, as well as social isolation and sense of community. One statistic that is a little disheartening, I think, that was shared on the sense of community page is that since 2013, the number of percentage points for life survey respondents who indicated that our community is open and welcoming has gone down by 14 percentage points. So you may be wondering, how does that connect to substance abuse? And the answer is pretty simple. Social isolation and support, being connected to other people, can not only be helpful in preventing substance abuse, but it's also really important to recovery and building a support system to help get you through and support those day-to-day challenges that so many people face as they're recovering. So some substance abuse data points. I'm not going to go too data geeky on you, but life survey respondents are concerned about, and these are just some of the things related to substance abuse. For more data on what the life survey respondents indicated concerns about, or just their opinions about various topics, there's a whole section in the back of the book called Demographics and Surveys. Illegal drug use, 87% indicated being concerned about this. And of all of the about 30 options for things that people were concerned about, when people were asked to rank what is their top concern, illegal drug use was the top concern, I believe for the second report in a row. Abuse and misuse of alcohol and prescription drugs also were huge concerns. The affordability of mental health, alcohol or drug abuse treatment services, And then drinking and driving also was something that a lot of people were really concerned about. And this one in particular was a little odd because 90.4% of life survey respondents said they were concerned about drinking and driving. Yet, of those same life survey respondents, over 10% of them have operated a motor vehicle after consuming 2 or more drinks in an hour at least once or twice in the past 30 days. Almost half of them were at 3 or more times in the past 30 days with that out of that 10%. So about 5%, 3 or more times in 30 days. That is terrifying to me. So, getting back to the purpose of the life report, we encourage you to take action. So there are additional copies of the full report and the snapshot available at the United Way office. If you want to take extras of what's here today, go for it. Again, the full color version of the report is available on our website. Feel free to share it. And something else that is on the website, the life report, when it was released, there was a 90-minute forum presentation, and that included 2 amazing local speakers, Tony Iniguez from Marshfield Clinic and Antonina Oshesky from Ascension, Wisconsin. And they talked about resilience. And so if you want to hear their great presentations, if you weren't able to be at the forum, that video is posted online, so I highly encourage watching it. And again, as far as being a catalyst for community change, change wouldn't happen without people in the community taking action. So I encourage you to take action in any and all areas of the life report that interest you and that you're passionate about, and being here at the AOD Partnership Meeting is a great start to that. Any questions? That's the super speedy version of the life report.
And this presentation will be loaded, just like the CART presentation and the one I'm going to do next, onto the website.
Okay.
Grab reports on your way out, don't forget. There's an executive summary document as well. So if you want a little bit more than the snapshot, but not quite the full report, the executive summary is online too. So I'm going to very quickly, Janine, if you don't mind, I'm going to very quickly go through what I have down for the Youth Risk Behavior Survey report, but I want to make sure there's plenty of time for Janine to talk about the new resource that we have in the community. A lot of the times people ask me, well, what's the data on this? Where can I find data on that? There's actually a new data platform that's very unique to Marathon County. Not very many health departments or counties themselves have it. So I want to make sure she has enough time. So I'm just going to very quickly go through this. Hopefully you guys all grabbed a copy of the report, because I'm not going to spend a lot of time on the specific data points. But just to give you a very brief history, and again, this is all going to be loaded onto the website, so you don't have to worry about taking notes, you can get it later. So the CDC developed this evidence-based survey tool in 1990. Can anybody tell me what was the drug that was really popular in the 90s? Late 80s, early 90s? Cocaine. So when you look at this report, there's a lot of things in here that I'll point out that maybe are lacking or we're really trying to beef up. For example, we don't ask questions specifically about meth or specifically about heroin. 2 big issues that have been impacting our community for a number of years, we're working on it. But just to give you kind of the history of YRBS, Wisconsin actually adopted YRBS as its survey tool for the Department of Instruction in 1993. So this is an online survey. It is something that is available. Historically, it was Bubbletron, for those of you that are around my age, 30s, let's just say 30s. You had to fill out the little bubble sheets. Now it's all online, which makes it extremely affordable because it's free, except for time. And it is something that, in Marathon County, we actually started some conversations about 5 years ago on how great would it be for us to be able to have all of our county data in one place. Historically, schools had been incentivized to do the survey with grant money and so on. That when that money went away, some of our schools stopped doing them, which actually kind of hurt our ability to know just where we're at. So we actually began to build that buy-in of all of our 10 public schools. We have private schools that also are interested in doing it in the future. But with the support of AOD Partnership, the Health Department, and Western Marathon County, we're able to get our first ever aggregate in 2015. 2017 marked the first year we had a middle school report.
So when you see the middle school report, it's the document right in front of the thicker green booklet. You don't see any comparable data. That's because when you look at what we can compare to, there is no state or national middle school data. So this is unique to our community. We're able to monitor our trends. So with 2017 being the first year we have that, we look forward to what happens with our 2019 report. And this was also how we launched that Marathon County teen documentary, which I mentioned at the beginning. The link is at the top of your agenda. So I encourage you, just like Amanda said, these are online. They are available electronically. We do have hard copies. If you have any meetings that you go to that are interested in youth, we'd be happy to come talk about it. Essentially what this slide means is that we had about 1,900 students in high school and about 2,900 middle school students partake in this survey. The middle school, we had 8 middle schools of the 10 that contributed to it. So it's a pretty good idea of what's happening in the middle school. And it happens from all over, this is kind of where all the school districts are listed. Like I said, we have private schools that are also interested in contributing to this report potentially in the future. But this report measures on a variety of different things. And I just pulled out a couple different things for this presentation. And again, I did this presentation intending there to be more here than I'm going to talk about. What I want to point out on this, though, is that the whole idea of feeling safe in school or being offered drugs at school are the 2 slides. We have some comparable data between middle school and then high school. Some of these questions are worded a little differently, so when you read the report, just keep that in mind, as the middle school report is not necessarily as in-depth or descriptive. Bullying was another thing. Amanda mentioned that this is one of the priorities as a community, but you could see just how important. One of the things that when we released those videos is that some of the statements were, well, this is something that's impacted kids forever, right? Bullying, self-esteem, drugs, depression. What we need to recognize, though, is that in here, the whole idea of the play of social media. If you haven't watched the Marathon County Teen series yet, look at the part on social media and how much that impacts their life. That is the difference, even from, again, being in my 30s, when I was in school. Depression and suicide, the percent of kids that were seriously thought about killing themselves, you look at 2,900 middle school students, you had 12.5% that thought about it. That is a huge number that we're not talking about. Same thing when you look at high school, compared to the national rates, our rates aren't terribly, I don't want to say bad in that way, but they are on the rise. You'll notice in the next report, we'll have Wisconsin data included. Wisconsin hasn't been able to get a good report on a state level for a couple years, so we're hoping that we'll be able to have Wisconsin data too, but that's just how all these ran through. Idea of connectedness, feeling a part of a school or having that one caring adult in the school situation. Traffic safety, the number of kids that report riding with somebody who've been drinking. I want you to notice the middle school data. It's almost a quarter of those students said they have. Who do you think they're riding with? Parents. It's about time we look in the mirror, just like Amanda said. Again, more alcohol data. We really look at 30-day use, how often the last 30 days has a student or has a youth used. Not necessarily if they've ever tried it, but it's just, is that a continual problem? So that's really what we look at in a lot of these different slides. And again, that perception. Do our parents perceive that this is wrong? Do our peers perceive that this behavior is wrong? Is another one of those data points. We're trying to get more of that peer disapproval in our future data sets. Tobacco use, things like chewing tobacco just don't go down. Things, like Jenna said earlier, using some of those sweet products, which I don't have included on the slide, but they're in the report. Those flavored cigarettes, for example, is something that we need to be concerned about and we need to be heightened about. Medication abuse, this is a data point that will be included in the Marathon County Comprehensive Plan as a precursor to future heroin and methamphetamine use. So this is something that you're going to continue to see. Marijuana, our perceptions continue to go down on a national level as to how much perceived risk there is with the use of marijuana. I'd be happy to talk to you about how big tobacco or big marijuana is mirroring the big tobacco industry, but it is something that would, again, never trying. I'm a drug-free communities program coordinator, naive title, I admit it. But never trying is one thing, but continuing to try that 30-day use is something that we really want to pay attention to. And then that last, again, I know I went through that quick, but you have the report. Enjoy the report, look at the report. If you have questions on the report, please reach out. And then you can, again, download it. So I'm going to stop talking about the report and turn it over to Jenna. Not Jenna, you're Janine. There's too many J's in my department now. And just point out that this platform is an investment from the community by a number of different partners, both on the startup as well as the maintenance of it, because it's over about $30,000 a year to keep this platform up. So it's something that's pretty impressive. Here's a screenshot, which I'm going to then take us to the website. Janine, if you want to introduce yourself too.
Yeah, so I'm Janine Foggia, a population health fellow with the health department. And so today I'm just going to kind of give you the highlights of the functionality of this data platform. So it's Healthy Marathon County Pulse. So I would encourage all of you after today, take some time to play around on here. So healthymarathoncountypulse.org will take you there. And I want to start just by talking about the richness of the data that's on here. So there is well over 200 indicators. There is local data as well as national and state data sources that are on here. And just to give you a feel for it's data not just from the health sector, but certainly economy, education, so it's very multi-sector. And so when we get into exploring data here, so we're just on the home page, you can search by a keyword, so whatever you might be interested in, and it'll populate what indicators relate to that. You'll also see dashboards on here. So we've created some that relate to our community health improvement plan and the priorities we've identified. Youth risk behavior survey that Melissa just talked about, that is all loaded up on here for you to access as well. So for today, I'm just gonna kind of pull up this dashboard for alcohol and other drugs. And these are just some of the indicators that we're looking at. So these ones that have teens on here are most likely YRBS data. And what you'll see is that it gives you the values, so current percentage, the year that the data is pulled from, and then you'll see some comparison data. So some of the data we're able to compare to a prior report, so like YRBS to the 2015. Some of it you'll see here, we have one that's compared to the US value as well as prior report value. And all these indicators, I'm going to take us into one just to show you the richness of what's there. So if we go into this adults who binge drink, what you're going to get with each indicator is up top here, it gives you the exact description. What do we mean by adults who binge drink? So it defines male and female binge drinking. And then there's kind of why is this important blurb here, and I think that's really great if you're looking to put some narrative or context around the data to really pull some of that out. But then when we get to the data itself, what you're going to see is here's the percentage adults who binge drink. It's going to give you the source that it's pulled from as well as the years of data. And then you have all these comparisons here. So if we look at Wisconsin counties and we hover over it, it's going to then kind of give us, what exactly is this red, yellow, green indicator gauge telling me? And so we're in the red, and red represents being in the worst quartile. If we look at Wisconsin value, we can see again red indicating not doing so well, and that the arrow's up, so our value in Marathon County is actually higher than the Wisconsin value. So certainly a lot of data here in terms of comparison. And then you'll also get some graphs with the indicators. So here we have trending over time. And then depending on the indicators, some of it you can break down by further subgroups. So here we have gender. So you could look at this by female, by male. Other indicators will have it by race, ethnicity. There's some age breakdowns. And some of our indicators as well, you're able to get at a zip code or even a census tract level. And I do want to highlight that because there is some unique mapping features with that. So say I just wanted to search poverty in here. So it pulls up the indicators related to poverty, and say I want to look specifically at children. And it's going to ask me, what breakdown do I want this by? So say I want to look at zip code. And then what it's gonna do is it populates a map of the county to give kind of that visual snapshot of what's going on with that indicator. So there is that functionality on here as well. So I would highly encourage you, take some time and dive into that exploring data. Like I said, well over 200 indicators, so lots to explore. But I also wanted to highlight this build reports feature, which I think is great if you're maybe looking to pull out some data and put together a one-pager, for example, to hand out to maybe your community partners, folks you work with. And so I'm just gonna do kind of a quick demo. So say I wanna look at the county as a whole, and I can get into my indicators. So say I wanna look at alcohol. What it does then is it pulled up all the indicators on the platform that have to do with alcohol. And say I'm really interested in teens. So I'm gonna click teen binge drinking, and then it's gonna tell you what exactly do you wanna display on your report. There's a lot that you can choose from, but I would say this indicator card kind of gives the best snapshot of those icons. So I'm gonna add it to my report, and it pops it right down here. And I can go back and I can, add another indicator. Say I wanna add another indicator card. And what you can do is you can drag and drop. You can even upload your own photos if you want to. So again, a really great way to put together a one-pager. And then you are able to save it as a PDF, download, print it, reproduce it. So that is certainly a feature that's here. And I'm going to take us a little bit out of the data piece itself and just highlight under resources here. It does have a couple of repositories, if you will, and one is funding opportunities. So if you are looking for grant opportunities, it does have a library that you can kind of access and see what's out there. But also I wanted to highlight this promising practices. So it's, again, kind of a repository of what others around the nation are doing in terms of what's best practice. And you can certainly search on the side here if you want it to be for children or teens, kind of what's your target population, a specific subject. You can even look at, I want a rural intervention. And what's neat about this is that you can actually, if you're doing something really unique, submit your own promising practice, and the organization that maintains this site will then kind of vet it. But if they approve it, it then gets put in this library, which all other communities across the U.S. that have this platform have access to this repository. So it's kind of a cool way to highlight the great work that you're doing as well. So that is there, and lastly, I'm going to just take us to on our About Us page. If your organization has a website, I would encourage you, you can put our little widget on there, and visitors to your site can click on it and it'll take them straight to here. The other thing that is neat is we can actually help create kind of a custom little mini dashboard. You see two examples here. That you could house on your site. So if there's specific data indicators you want to highlight on your own website, we can certainly craft one of these. You'll see this has to do with some of the youth risk behavior survey data. And again, visitors to your site could click on this and it would take them directly here. And lastly, I would say the other thing we are doing is we are more than happy to provide more in-depth training. I know this was a very broad, kind of touching on just the key highlights, but if you'd like some assistance and kind of a deeper dive of some of the data or just the functionality, we're happy to do that, and you can go to our Contact Us page and just let us know, and we'd be happy to assist with that. So I think that's kind of what...
Do you have the storytelling on your
Yes, thank you for reminding me. So back on our home page, one of the things we're wanting to do is data is more than just numbers. It certainly drives community action. And so we would like to be able to feature different organizations or coalitions that are utilizing data in a way to actually launch initiatives. And so if you have a story idea or something to feature, we'd love to hear from you and put it on here. We'd like to rotate this monthly, but this first story here has to do with the YRBS data and just kind of how the behavioral health counseling consortium in the schools kind of came out of some of that data. So again, just really want to be able to highlight that data does drive community action. So with that, I know that was a lot, but are there any questions I guess I can answer?
Can you click back on the Explore data?
Yes.
And maybe just, you could pick whatever one you want. Did
Do
you
you-
go over the different, like the differences in how the
Yes,
pluses
yep,
and
the
equals?
icons,
Okay,
yep. Yep.
sorry. I missed
So,
that.
yeah, and we looked at your chip priority up here
Perfect.
too, so.
Does anybody have any questions? So this is a new resource, free resource. So if you're looking for data, please try here first, because all of it's here. National, state, regional.
If you have data you're collecting and that you think is valuable to the portrait of the community, you can also submit that data to them through the Contact Us as well. So if you are doing some sort of assessment within your organization, if you're seeing certain trends on, North Central Healthcare is seeing this last year saw an uptick in methamphetamine diagnoses. That kind of data could also potentially be added to this website. We have the freedom to add our own local data. So it's very unique. It's very awesome. It's been a number of years in the making. So with that, I am out of stuff. With 7 minutes to spare, which will get you back to the parking lot at about 1 o'clock. Okay, 6 minutes, it just passed. Please make sure again you take extra copies of reports. If you'd like, turn in those sign-in sheets and see uniforms. We got the tobacco handouts here that you might not have seen when you came in, check them out. And you also have Megan's and Jenna's cards up here. Thank you. Have a wonderful afternoon.